Okay, so what I'm going to do is now I'm going to do the gloving procedure. So let's presume that I have done my surgical hand washing and I'm going to glove up. So first I'm picking up skin to skin, glove to glove. So first secure your thumb and then do it. So please secure your gloves so that you don't have to go back to pull your gloves. Okay. So I'm going to remove this tape off so that it doesn't come in way of my thing. And so you see. Okay, so I'm not going to go back again, and I'm going to open the dressing pad, keep it in the center. First what I'm going to do is I'm going to arrange my things. Okay. Now when you see here collection of equipments, I did not take a closing Mepor because the wound is very clean, it is dry and doesn't need a Mepor dressing to cover. So that is the reason I have not taken a Mepor. But if you need any other extra equipments, you need to take all those things. So if you see here, we have 4 forceps. Okay, so 2 is for all the 4 are sterile at the moment. So what I'm going to do is first I'm going to take the cotton and nicely squeeze it. So I will squeeze all the cotton so that it's easy for me to pick and clean it. So I'm going to, okay, some videos don't recommend using cotton. I think what they suggest is that don't use dry cotton, but if it is clean and if it is wet cotton, you sure the whiff of the cottons is not going to be tangled in the wound or the incisions, then I think you can use it. Okay. So when you are squeezing, please ensure that there is no saline, there is no excess fluid dripping. Okay, so if you are seeing how I am handling the forceps, I am not touching the tip of the forceps. Okay. So here you see I am squeezing. So here let's say I want to use some cotton gauze pieces also. So if you have a bunch of gauze pieces like this, what you do is you have to see which is the closed end and the open end of the gauze. Now this is a closed end and this is an open end of a gauze. Okay, so if you're picking up from the open end, sometimes your gauze just opens up and it's a bit messy for you to handle it. So I always suggest to hold it with my closed end. Now I know in fundamentals they taught you fold this way, and then yes, it's neat, but sometimes it's when you have a big wound and it's very laborious to close each of the gauze pieces. So I go in such a way that my main focus is I am not breaking the asepsis. So what I do is a simple way. So I hold the forceps diagonally like this, I dip it in the solution, and then I just roll this way in a clockwise, and then again I roll it in the anti-clockwise, and you see my gauze piece is wet but it doesn't have any saline in it. So when I'm holding the forceps, the gauze piece, I only take care that I hold in such a way that the tip of the forceps do not come in contact with the skin of the patient. So if you see, I'm holding it in such a way that the tips of the forceps are covered well and it's not in contact with the patient. Okay. So now what I'm going to do is I'm going to start cleaning. Okay. So as we described in the assessment, this is a clean wound and it has no infection and it's a vertical wound. So I'm going to clean from the clean area to the dirty area. So if it's a clean surgical wound, surrounding of the wound is sometimes considered as unclean. So I clean the incision first and then the surrounding. So what I do is I have forceps. If we remember the concept, any equipment which is out of the set is unsterile. So I pick up one and then I keep the second forceps back into the field, and then I'm going to clean it, and applying enough pressure I just clean in a straight sweep. Okay, and then I dispose it. Now because this left the field, this is considered as unsterile, I use the forceps in the field to pick it up, and see when I'm holding it or transferring it, my forceps don't come in touch with each other. Okay, and again I clean it. Okay, and I discard. So now that I have cleaned the surgical wound, I'm going to clean the pins. So again I transfer. Okay. While you are cleaning the pin, always remember the concept that the area closer to the skin is supposed to be more clean. So I do not want to clean from up to down, but I want to clean from the skin upward, so that I don't cause any infection. Okay, so I clean from down up. Okay, I turn. Okay, and I turn and I put. Now supposing if you want to use for each sweep one cotton, it's fine, but only thing is be conscious of your resources, because if there are multiple pins, again you are going to be wasting a lot. Okay, so again and I discard it. So this way you need to clean all your things. Now let's say you are run or short of cottons, and you need to use the gauze piece, so you can hold it. Again you see I transfer without touching the other forceps. Okay, and then I clean. So I clean around the pin in a surgical fashion, in a circular fashion. Okay, and then I discard it. So once after you have cleaned everything, and then I discard this. Okay, then I still have 3 forceps. So if you want to do anything else with the pins, you can do. Now certain institutions follow the practice that they wrap gauze pieces around the pins, and these gauze pieces are soaked in betadine. So according to your institutional policy, you can do it. So now what I'm going to do is just show you how to wrap it. Now sometimes students can get this kind of expertise only when you are practicing. So if you don't have this kind of a dexterity, it's fine. You can use your hand, because both your gloves are still sterile. Okay, but if you can do it, I suggest doing this also. So now because if this cotton gauze piece is soaked in betadine, you will find that it is nicely wet. So I'm taking it and I hold it around, and then I wrap it. Okay. So once you leave it like this, don't be worried that if this one will remove, because if it is with betadine, it usually will not unwind, it will be there staying together. So if I want to again pick it up, so I keep the forceps in the edge and I use the other sterile one to pick the next gauze piece, and I can wrap it up. So once I have done the dressing, I can just leave it like this, because we don't have to do any occlusive dressings. If you require an occlusive dressing, you do cover it with the gauze, with roller cottons and roller bandages. So let's say I'm finished with my dressing procedure, so I need to throw away the things, because this is a disposable set. I keep all this, okay, and I wrap it and throw. So this is a sterile towel. Actually I did not use the sterile towel, but you can use the sterile towel to keep this under the wound. you can just ask somebody to help you out, or the patient to lift the hand, and then you can just slide this down so that your field is sterile field. Okay, so I'm wrapping it, okay, and then I throw it into, okay, and then I pick it up and then throw it into the infected yellow bag. Okay. Now please remember, this dustbin is near the patient, so I just went there to discard. But you would not do this without leaving the side rails open. So if in this case, because it's just close by, I just used my foot and opened it. But please do not leave the patient without sterile. So do a hand rub and then wear gloves again. Before you touch the patient or the side rails. Okay, so you need to actually wear clean gloves, the side rails, comfort of the patient, put the patient in a comfortable position, and then you leave the area. So take the trolley bag, clean the trolley, and then replace it so that the next person uses finds it in a good condition. So this is how you do a wen site dressing. You can use the same concept for your surgical dressings also. So if you have any doubts, please feedback, give us in writing. I hope it was a fruitful learning for you and you enjoyed watching the